Mandibular movements. These are the contents of this class. Moving on to the definition. Anterior guidance. This is the influence of contacting surfaces of anterior teeth on tooth limiting mandibular movements. Mandibular movement, the arc of closure. The circular or elliptical arc created by closure of mandible, most often viewed in sagittal plane using a reference point on mandible. Arrow point tracer. This is a mechanical device that is used to record the pattern of horizontal mandibular movement. Bennett angle. This is the angle formed between the sagittal plane and the average path of advancing condyle. Bournville triangle. This is an eponym for a 4-inch equilateral triangle bounded by line angles connecting the contact point of mandibular incisors edge to each condyle. Border movements of the mandible are the limits dictated by the anatomical structures as viewed in a given plane. Mandibular condyles may rotate and translate. Condylar guidance is the mandibular guidance generated by the condyle and articular disc traversing the contour of glenoid fossa. Condylar path is the path traversed by the condyles in the temporomandibular joint during various mandibular movements. Envelope of motion. There are 3-dimensional space circumscribed by the mandible during the border movements. This is called envelope of motion. Functional occlusion is the contact between the maxillary and mandibular teeth during mastication and deglutition. Functionally generated path, which is called as FGP, is the movement of occlusal surface on teeth or occlusal rim. Laterotrusion is nothing but the lateral and upward movement of the condyle on working side. Mediotrusion is the movement of the mandible from the frontal plane. Non-working side is the side of the mandible that moves towards the midline in lateral exertion. According to the functional, the movements are classified based on mastication, speech, respiration, facial extension and voluntary movements, and non-functional movements. According to Sherry, it is divided into protrusion, retraction, lateral gliding movements. According to the teeth, it is the movements with contact between the upper and the lower teeth and the movements without the contact between the upper and lower teeth. These movements of the mandible are limited by the joint structures and masticatory system. According to the movements that occur in TMJ, it could be either rotational movement or translational movement. The biomechanics of these movements may be either rectilinear or curvilinear. The two types of movements that occur in the TMJ are rotatory movement and sliding or translation movement. Translation is that occurs in the superior joint cavity between the superior surface of the articular disc and the mandibular fossa. These are the 3 planes in which the mandibular can rotate. And this picture shows the movements of the mandible in the frontal plane, sagittal plane and horizontal plane. During opening and closing, the mandible moves in the sagittal plane around a transverse axis that passes through or near the condyle. In the lateral exertion, the mandibular movements around the vertical axis pass through or near the condyle. These are pictures that show you the various axes along which the mandible can move.